Good morning, everyone. Thanks for joining us for the October 2018 CDA Vendor Webinar. I am Mindy Durrance and will be presenting along with my colleagues, Dr. Dan Pollock, Casey Thompson, Wendy Wise, Ahmed Tahir, and Amy Webb. We will be presenting primarily CDA-related information that applies to the upcoming 2019 January release. This webinar will be posted on the NHSN CDA Submission Support Portal soon. We have a lot to present, so let's get started. Dr. Pollock?
Thanks, Mindy. And I'll add my welcome to Mindy's. Appreciate everyone participating. And we'll go to the next slide after NHSN updates to talk about some important milestones that we've achieved with your help. Thanks to all the vendor implementers for their contributions to AU and AR reporting, which now has reached and gone beyond 1,000 and 300 hospitals reporting, respectively. We also want to take note of the fact that later this year we'll be launching the outpatient procedure component in NHSN with plans further on down the line to add SSI reporting via CDA to the new component. We'll talk more about that. And a look ahead to 2020, we're planning to introduce the neonatal component with the late onset sepsis meningitis healthcare-associated infection event being the initial event that would be reported, and all those events would be reported via CDA, and that work is in the pipeline. Next slide. I also want to draw attention to our ongoing synthetic dataset project. And the purpose for this project is to use synthetic datasets that we provide to ensure AU data are aggregated correctly. It's not a project that's designed to validate CDA file submissions, but rather to validate that the protocol has been correctly interpreted and implemented with files delivered to a CMS website for validation purposes using Excel spreadsheet format. In the pilot antimicrobial use synthetic dataset project in 2017, there were 2 vendors who successfully validated. In the production version of the synthetic dataset this year, 1 vendor has successfully validated. This updated version in 2018 includes antimicrobials and routes of administration that are not in the current AUR module protocol but will be added. We have a pilot antimicrobial resistance synthetic dataset project in the works with a release planned later this year. If you're interested in obtaining more information or participating in either of these synthetic dataset projects, please contact Wendy Wise at the email address listed on this slide, and a 20-minute video demo of the project is available. Next slide. We're continuing our NHSN release schedule of 1 major release a year. The changes are going to include protocol changes, the transitions to new CDA versions that reflect those protocol changes. And again, our January 1st is a target. We may add non-major releases to include new components, minor change requests, defect resolutions, and infrastructure maintenance and support. Next slide. The NHSN release schedule, release 9.0 was deployed successfully in September 22nd, and 9.2 is scheduled for December of this year. Defects effective immediately post-deployment will be addressed, and CRs with effective dates will be effective January 1st, 2019. And we have a defect list at the NHSN webpage with the URL listed on this slide. There's a new help desk system that we've implemented, iSupport. We're moving to iSupport Help Desk solution with continuing to use some of the same emails for specific help requests, namely the NHSN CDA at cdc.gov, for CDA-related issues, and NHSN and CDC.gov for protocol, analysis and reporting, and other aspects of the application. Based on ticket number for tracking purposes is the new iSupport system, and it's tentatively scheduled for use in beginning in 2019.
All righty, thanks, Dan. Now we'll turn it over to Ahmed Tahir.
All right, thanks, Amy. Thanks, Dr. Dan. So I'll get into the new release in 9.2. Next slide. All right, we'll start with a couple of defects that we corrected in 9.2, 5133 and 5154. We found out that the HL7 code wasn't being validated for any CDA, and different CDAs had different validation paths. So we have corrected this information so that the application validates both the HL7 code and the your code. Next slide. Defect 8296 is for CDI reporting for FAC-wide in and IRF locations. Facilities should report the same CDI test type during the third month of each quarter between the two locations. When a mismatch occurs, the NHSN application should produce a confirmed CDI test type alert. Currently, the alert is not always being produced. We have corrected this, and an alert should appear if there is a mismatch. And again, this defect does not have any CDA impact. Next slide. All right. We'll go over now the new change request in 9.2. CR2054 is related to lab ID. When the outpatient field equals yes, there is no need for the facility admission date. However, for CDA imports, this field is required by the CDA schema and will be not stored in the NHSN database, but we will have it within the CDA. Next slide. CR2045, this will be for our yearly ICD-10 and CPT codes updates. A few additional updates to this is that we are planning on versioning the codes and removing this from the IDM. It will be sent out separately, named ICD-10 PCS procedure code mapping to NHSN operative procedure codes. We will provide more information on this when it becomes available. Next slide. CR1971 is our yearly update to the pathogen codes. Updates are made on this list in the business rules for 2019. We also listed out here different dates on what pathogen codes should use for the business rules in the list. If we can go to the next slide. A few notable changes to the pathogen list is being updated to the 2019 business rules. The HV column is being grayed out now because it will use the complete pathogen list, and parasite and viruses will no longer be valid for BSI LCBI. And if we can go to the next slide. We also had 3 Enterobacter species that changed genuses. You can see them listed here below, and we've also mentioned in which tabs the MDRO definitions and unusual susceptibility alerts these updates are being made in. So here you can see on the slide where those changes are and what was changed. Next slide. Right. For CR 1676 is to bring a new CDA import for VAE. VAE will use the R3D2IG and will be valid for event dates 2019. You may refer to the supplemental documents for additional information. We also re-added the code for no pathogens identified, and it has been added to the HAA VOC and the IDM. Next slide. The next 2 CRs are for BSI. CR 1716 is the addition of 3 new fields, which will now be required to answer. And in addition, an optional comment field has also been added. CR 1711 is the update of BSI from R9 to the R3D2IG. And you can refer to the following documents listed here below. Next slide. CR 1893 is to add business rules limiting surveillance period for deep incisional secondary SSI events to be entered within 30 days in the application. And CR 1867 is to remove MDRO and CDI encounter fields from MDRO FACWIDE out. Due to CDA schema requirements, CDI encounters must be included in the CDA. For now, the user can just enter 0, and the application will not store this number in the database. We will make an update to this in a future IG. Next slide. So here on this slide, we have compatibility deadlines. So just to review for the BSI CDA change, any events dated between 2014 and 2018 will use the R9 IG, and anything equaling 2019 will use the R3D2 IG. Next slide. My last two slides do not have any CDA impact yet. It is more just FYI for now. CR 1822 is the addition of new fields to the BSI form. BSI will be changing to R3D3 IG. And again, this will not be for 2019, it will be for 2020. And lastly, CR 1576 is adding a new event, PET-VAE. We did include a tab for this in the 9.2 IDM, but there are no immediate plans for CDA yet. And also based on feedback we received in our meetings at APEC with vendors, we will send out any 2019 protocol-related changes that we recently received, and these do not cause changes in the application. Please keep an eye out for an email that will be sent out in the near future. Next slide. And I will turn it over to Casey. Thank you.
Thanks, Ahmed. Hello, everyone. My name is Casey Thompson, and I'm going to discuss the Antimicrobial Use and Resistance Module 9.2 change request updates. Next slide, please. Okay, first up, let's discuss the AU updates. Change request 1873 is adding a new drug to the AU option, meropenem vaporbactam. The FDA recently approved this new drug for use because of its treatment capabilities against CRE. The drug is optional. It can be added for any year, and it's included in the new version of the IDM. Next slide, please. Next is change request 1854, moving delafloxacin from optional to required for 2019. Delafloxacin will be required for all AU CDA files containing data for January 2019 and later. This will also increase the number of required drugs for the AU option to 90. Next slide, please. Change request 2014 involves an update to the SAR models and has no CDA impact. The AU team has now updated the SARs based on 2017 AU data. 2 new locations were added, and we renamed and recategorized the SARs. The new 2017 SARs will be available for data from January 2017 forward, and the 2014 SARs will still be available for data from 2014 to 2018. All of the updated information will be included in the 2019 version of the AUR protocol that will be posted on the NHSN website in the next few weeks. Next slide, please. Okay, now let's move on to the AR option changes. Change request 2003 adds many new organisms and drugs to the AR option, including additional species of Candida, Citrobacter, and Proteus. We also updated the AR drug panels to add and remove relevant drugs. These changes are in the IDM and impact AR events with specimen collection dates of January 1st, 2019 and later. Next slide, please. Change requests 2004 and 1875 add new reports for the AR option and have no CDA impact. As participation in the AR option continues to grow, users have started asking for additional analysis reports for AR option data. Currently, we have just 2 reports available, a simple event line list and a facility-wide antibiogram report. The new reports will be very similar to the reports currently available for the HAI antimicrobial resistance data, a line list, a frequency table, and a rate table displaying antimicrobial resistant organisms. We also plan to add a new AR bar chart report. Next slide, please. Yeah, change request 1875 adds a new AR line list denominator report that will display patient days and admissions. Currently, users are only able to view these numbers by exporting the analysis data sets, so this new AR line list denominator report will be very helpful. Next, I'm going to turn it over to Amy Webb to discuss the AUR 9.2 defects. Amy?
Thanks, Casey. First, I wanted to talk about a 9.0 change. This was defect 8318. We discovered that duplicate AR events were getting into the application, so we tightened up the application rules so that duplicates are no longer accepted. Defect 8318 was fixed in release 9.0, which was actually already deployed on Saturday, September 22nd, but it was important enough that we wanted to alert you to it, just so you could make any updates if needed. As a reminder, regarding the 14-day and 1 per month duplicate rules, we do have specific guidance in the protocol for these scenarios. For the invasive specimen sources, such as blood or CSF, only 1 AR event per 14-day period per patient ID per organism should be reported to NHSN. For non-invasive specimen sources, such as urine or lower respiratory, only 1 AR event per calendar month per patient per organism should be reported to NHSN. As a follow-up to defect 8318, defect 8336 was created so that we could remove those duplicate AR events from NHSN. The NHSN team will be reaching out to individual facilities that had those duplicate events to let them know, and this fix is planned for the 9.2 release in December. Additionally, change request 2179 was created to clarify the error message that's received when a duplicate is uploaded. This CR is slated for the 9.3 release of NHSN in 2019. Next is defect 6266. As noted in the NHSN AUR protocol, for Staph aureus, there are 2 additional susceptibility tests that should be included in the CDA file, the PBP2A agglutination and the PCR MEC gene. Upon import, the NHSN application was not checking whether or not these 2 tests were included in the CDA file. Validation to check for these 2 tests will be included in the upcoming 9.2 release. So we wanted to make sure you were aware of this, as you may need to update your software to include these 2 tests in your CDA files for Staph aureus events. As a reminder, if these 2 tests are not included for Staph aureus events, then the CDA file will not be accepted into NHSN. Next, defect 8302. NHSN is currently accepting AR events with the location of specimen collection being outside the rules of the protocol. For example, events with outpatient oncology clinic or inpatient fac-wide-in as the location of specimen collection are currently being incorrectly accepted into NHSN. Remember, you should only report AR option events using the locations outlined in the most current IDM. This fix will also be included in the 9.2 release in December. Related to defect 8302, related is defect 8302, CDA files with mismatched inpatient, outpatient section codes were incorrectly being accepted into NHSN. For example, AMB, or ambulatory, in the inpatient, outpatient section coding of the CDA file when it's actually an inpatient location type, or vice versa, IMP, or inpatient, in the inpatient, outpatient section of the CDA file when it's an outpatient location type. Remember, you should only report the AR option events using the locations outlined in the IDM. The next slides show examples of the mismatch and corrected coding. This example shows the inpatient-outpatient section coded as AMB for outpatient in line 86, while the HL7 code 1029-8 on line 238 is actually for a medical, surgical, critical care unit, which is not an outpatient location. This CDA should not be accepted into NHSN, but it currently is being accepted. This will be fixed in the 9.2 release to prevent these types of mismatches from being accepted into NHSN. This slide shows an example of the inpatient-outpatient section code using IMP while also using the HL7 code 1029-8 for an inpatient location. This is the correct way to code this section of the CDA file, and this file will be accepted into NHSN. That's it for our AUR module defects and change requests. Next up, Mindy will present on the outpatient procedure component. Mindy?
Thank you, Amy. Next slide. The outpatient procedure component was added to the application in last month's deployment. It includes an event and a denominator for same-day outcome measures, a new surgical site infection event, and a new denominator for procedure. The SSI procedure forms are different than those used for the patient safety component. Data entry is via manual entry or CSV for procedures only. CDA import is not available at this time. It is currently scheduled to be added in 2021. Existing SSI procedures in the patient safety component were copied to the outpatient procedure component. In OPC, users would be able to view the historical data but will not be able to edit. Next slide. Users may begin adding outpatient procedures in the OPC for procedure dates greater than or equal to November the 1st of this year. New protocol will be posted to the NHSN website prior to November the 1st. So far, we have not heard of any vendors submitting SSI procedure CDA for an AMSurge facility. However, if you would like an AMSurge test facility in the outpatient procedure component, complete the request form found at the following link shown on the screen and send to the CDA mailbox. Next slide. Let's take a quick look at the forms. This is an example of the event and summary forms for same-day outcome measures. Note the fields for patient burn, patient fall, and also the wrong event section that includes fields for wrong side, wrong implant, wrong procedure, and so on. The summary form collects the total number of encounters. Next slide. This is the OPC SSI event form. You'll notice that it contains some of the same fields used for patient safety. A big difference are the questions on page 2 on how the SSI event was detected. Next slide. This is the OPC procedure form. Once again, a little different than the procedure form in the patient safety component. A smaller list of procedures will be reported for the outpatient procedure component. Next slide. Next, we'll review CRs related to the dialysis component. Next slide. So let's review dialysis changes for the 9.2 release, which is for January 2019. Changes will occur for events and summaries that are greater than or equal to January the 1st, 2019. For CR 1928, a pediatric outpatient hemodialysis clinic will be added for dialysis facilities that only serve pediatric patients. The facility type equals AM Hemoped. For CR 1929, the dialysis event date is required to be greater than the patient's date of birth. CR 1976 includes enhancements to the business rules for ESRD and AKI. Please refer to the dialysis protocol for details. CR 1971 is the pathogen code updates that Ahmed presented earlier. Next slide. You'll be happy to hear that there are no dialysis CDA version changes for January 2019. Just a reminder, dialysis summaries with dates equal to or greater than 2017 must use the R3D1 version of the IG. Dialysis events with event dates equal to or greater than 2018 must use the R3D1.1 version of the IG. Next slide. Next, we will discuss the flu CDA that is part of the healthcare personnel safety component. Next slide. Influenza vaccination summary will be a valid CDA import for 2019. It is also referenced as just the flu. It is included in the healthcare personnel safety component. It will be a valid CDA import after January the 1st, so that means you will be able to import your 2018-2019 influenza season summary via CDA import. For your development, the HPS component has been added to most test facilities. If you still need an HPS component, please send an email to the CDA mailbox. Next slide. The flu CDA will be based on the R3D2 implementation guide. We distributed the R3D2 IG package, but it does not include the HTML format. The link to the IG on the HL7 site is listed on this slide. Remember, you must log in to the HL7 site to be able to download the IG. To assist with your development, we've included supplemental documents. There is a separate HPS IDM. Also included are the mocked-up flu paper form and the flu summary mapping. The flu XML sample is included in the R3D2 IG package. Next slide. This is a display of the flu summary form. The data is stratified, which is similar to how the NICU summary is designed. Next slide. Next, we'll discuss some miscellaneous updates. Next slide. This slide is a display of the percentage of CDA imports versus manual entry or CSV import for procedures. The year-date range was selected to include completed quarterly CMS reporting. We have added the CLIP event to the table. Besides AU and AR, which are 100% CDA imports, notice that Lab ID and dialysis events are the highest at 58% and 73%, respectively. The MBRO summary remains the lowest. The percentage for most events are slowly increasing. Next slide. Just a quick update for direct CDA automation. We are holding at 14 vendors sending via direct. The number of facilities sending via direct is slowly increasing and is now greater than 6,000. For those of you who do not use direct yet, it is a batch submission process with no immediate reply. Turnaround time is based on the volume of messages in the queue. If you are new to direct or want to learn more about direct, there is a direct toolkit on our NHSN website. Before you start your process, we recommend that you schedule a call with us. We will be happy to discuss the direct process and recommend best practices. A developer and direct administrator join the call for a technical discussion. Next slide. We want to update you that the location mapping export enhancement has been moved from the January 2019 release to the spring 2019 release. The columns for the CMS, IPS, and IRF and the CCN will be added. Also, the month and year the location was inactivated will be displayed. Just a reminder, to export the location list, click on the Export Location List button. The screenshot shown gives you an idea of how the data will be displayed. Next slide. CDA support is available on the NHSN website. The first link is to the main CDA submission support portal. Other important links provided on this slide are to the CDA Toolkit and Guide to CDA Versions. 2019 CDA Version Guidance has been posted. And just as a reminder, NHSN supports CDA versions that are valid for the past 2 years. Next slide. A few more helpful resources may be found using the following links. The first one is the NHSN newsletter, release notes, the next one, release notes and communication updates, and then last, the defect list and release schedule. Next slide. The pre-production test site, also called the NPPT, is a copy of the NHSN development environment. It now includes analysis and reporting functionality, so the antimicrobial use and resistant data may be verified. It does not include direct CDA automation or groups. There are no SAMS credentials required. If you would like to have a test facility in the pre-production environment, complete the form found on the website and email to our mailbox at NHSN CDA at cdc.gov. Next slide. The pre-production test site is currently the 9.0 environment. As a reminder, at the login, read the important message. The effective date for 9.0 is June the 1st, 2018. Version 9.2 code is scheduled to be deployed to NPPT around October the 20th. The effective date for 9.2 is July the 1st, 2018. The 9.2 beta test period is currently scheduled for October the 22nd through November the 2nd, and users are currently being recruited. As you know, during the beta test period, new locations and monthly plans are not saved, but any added prior to or after beta test period will be saved. As always, your feedback is very important and assists us in improving changes and correcting issues, so thank you. Next slide. Next, we're going to talk about the future CDAs. Next slide. As we discussed today, 2 new CDAs will be available for import beginning January 1, 2019. They are the VAE and Flu Summary CDA. The BSI event will move from the R9 to the R3D2 version and will include 3 new fields. In the spring 2019 release, we plan to have a soft roll-on for the R3D3 Dialysis Summary CDA that will include Report No Events. After the spring release, both versions will be valid for the rest of the year. The current R3D1 Dialysis Summary CDA will not be valid for 2020. Planned for 2020 are the updates to ICU, NICU, SCA, and NDRO Summary CDA, and will include Report No Events. The BSI event will be updated to include a few more fields, as Ahmed discussed earlier. The R3D3 IG is in the last stage of the HL7 ballot process and is expected to be published soon. Next slide. A neonatal component is planned to be added to the NHSN application in the summer of 2020. It will include patient-level event and denominator for late-onset sepsis and meningitis. It will be CDA import only. For 2021, CDAs for the outpatient procedure component events and denominators are scheduled to be available. Also, for 2021, the AR summary will move to a new CDA version. It will include Report No Events and updated code to allow for an outpatient location. Next slide. Just a few reminders. As always, we welcome feedback. We offer individual vendor conference calls. Make sure you're on the NHSN CDA email distribution list. To be added, email the CDA mailbox with your request. And also be sure to visit our CSSP site. Next slide. This concludes our October 2018 CDA presentation. We will now turn off the recording. Thank you.